When Uganda joined the rest of the world to combat the outbreak of COVID-19 back in 2020, it quickly became apparent that the country was fighting two pandemics. The first pandemic was the COVID-19 pandemic, for which 2 national lockdowns were imposed to stem the spread of the disease. Secondly, the country found itself facing an underage and teenage pregnancy crisis due to the 2 lockdowns. A United Nations Population Fund report in 2021 revealed that the country had recorded 354,736 teenage pregnancies in 2020 and 196,499 in the first 6 months of 2021. This was an average of 40 pregnancies per hour.
The guidelines, the policies, especially on SRHR, sexual and reproductive health, they are not being prioritized by our country.
Over the years, civil rights groups have called for increased access to sexual reproductive health information for young people. However, there is still stiff resistance from civic groups like the church, cultural organizations, and parents themselves,
who think that if these guidelines are passed, the children are going to get spoiled the more, that they will get information that they are not supposed to get.
Now, a national dialogue on the state of sexual reproductive health and rights between different stakeholders has been called by the Sexual Reproductive Health and Rights Alliance this morning to devise means on how this challenge can be addressed. During the meeting, it emerged that little has been done to push the right information to young people on how they can protect themselves from early sexual debuts.
We are sitting on a time bomb, we can all agree. Having over 1,000 young people getting pregnant in a day, that is not something to be proud about.
Early sex is a problem in this country. Early sex is a problem. However, all measures that make sure that our young people can delay sexual activities should be considered.
We forget that where they are placed, there's either a cultural connotation, cultural mindset, or there's a religious one. That's why in all this space, you get either religion or you get culture.
But if you're sexually active with information, with empowerment, if you know what to do, because we are young people, I don't believe that we can live away without body urges or body needs.
There are concerns that the country's regulatory framework on penalizing sexual offenders is not being implemented, which has given room for sexual offenders to walk free when they commit crimes of rape and defilement.
As leaders and policymakers, it is our mandate to ensure that we create an enabling policy, legal and socio-economic environment where every young person in their diversity, including those living with HIV/AIDS and persons with disabilities, can freely and equally access high-quality sexual reproductive health information.
Local leaders at the meeting also decried inadequate funds provided by government towards youth activities like access to sexual reproductive health information.
The issue of SRS challenges, local governments are better positioned to address the challenges because we are the closest to the adolescents, the young people, and the youth.
Currently, if you are Traverse National Municipality, in all our primary schools, I have 49. But you may find we don't have enough money to construct toilets. You find a girl and a boy sharing the same toilet. Then what there happens?
Without addressing these critical gaps, the SRH Alliance warns that the country will continue recording high cases of underage and teenage pregnancies. Joyce Nakato, NTV Weekend Edition.
Ground.